Thank you very much, Krista, and I'm really grateful to be here to speak at this conference. I'm John Carzoli, and really excited to chat with you all about some of the things that we've been working on here related to musculoskeletal health education for community health workers and agricultural workers. So good afternoon or good morning to those on the West Coast. Muy buenas tardes o buenos días. So I'll start off just by sharing a little bit about myself. And I'm a physical therapist by trade, practice physical therapy. I have practiced for 20 years in the area of musculoskeletal health and prevention. I lived and taught physical therapy in Bolivia for a couple of years, which struck my interest in a physical therapy program. It struck my interest in higher education. And so I actually transitioned to a full-time educator at Western Carolina University in the Department of Physical Therapy. And I've been doing this work for about 8 years. During my 8 years, I have collaborated broadly with a number of really amazing organizations. I have up here Vecinos Farmworker Health Program, who's housed kind of inside our building at the university, and they do some amazing rural health farmworker healthcare. And I'll share just a little bit how I got involved with them, which just kind of led to this topic here today. In a number of other agencies, the North Carolina Farmworker Health Program, North Carolina Agribility, and done some stuff with the National Arthritis Foundation Agribility as well. Some of this work is related to an educational doctorate that I'm also on the tail end of in the realm of hybridizing health education. Again, really grateful to be here. I was asked about sort of whether or not to take questions throughout or at the end. I'm very comfortable if you have some questions as we go, just to plant those in the chat box. And Krista can cue me, or I can kind of follow as well. So just wanted to also share that part of this project, at least the development of some of the content, we were able to develop through a fund through the Southeast Center for Agricultural Health, which is kind of managed, housed in the University of Kentucky, and that's through funding of NIOSH and CDC. And so some of the big learning objectives that I hope to get across today is to really find some ways to help increase access for migrant and seasonal agricultural workers to newly developed musculoskeletal health education resources. So I guess you'll hear me bounce back and forth between migrant seasonal agricultural worker, farm worker. Probably just use farm worker for the sake of ease. For y'all to have a sense of how to identify the primary means of accessing these resources that we've been working on developing with various stakeholders and distributing these resources to key stakeholders involved in agricultural health as well. Maybe most importantly, to get some input and feedback from you all, how we might be able to really best utilize and disseminate some of these educational resources in a way that best serves your audiences, the farm workers that you may serve or the constituents that you may serve. So just to give you a little bit of background, and my guess is that if you're attending, you have some sense that musculoskeletal issues in farm working populations is fairly high. Farm work is consistently ranked as a fairly dangerous occupation, not necessarily with just due to fatalities, but due to musculoskeletal aches and pains and symptoms that sometimes can limit work. And some of this is related to the highly repetitive and physically demanding tasks that farm workers have to carry out to provide food for us. And I wanted to just share just a little bit about how I got involved. When I started at the university about 8 years ago, vecinos came to us and they said, "Hey, wow, you guys are physical therapists. The number one thing were all of these clients that we serve in Western North Carolina. Vecino serves about 1,000 farm workers and their families in Western North Carolina, primarily through mobile health. So they travel throughout. Western North Carolina is very mountainous. It's quite rural and very spaced out. And so they were reporting that one of the number one complaints was lots of back pain and wrist pain, and some of the crops in Western North Carolina, the big ones are strawberries and tomatoes. Those are kind of some of the big ones. I said, "Hey, what could you do with us, and what can you do to help us out?" And I said, "Hey, well, I'd love to get out to some of the farm worker camps and to some of the farms and see what's going on here." And as you can appreciate, in the mountains and rural environments, this is sometimes involving driving an hour and a half one way, and so a total of 3-hour trips. And certainly did seem to be quite a bit of prevalence of musculoskeletal issues, and some opportunities to provide some both direct care, but maybe more so some education on what sort of aches and pains are fairly normal and typical, and what sort of aches and pains may go beyond typical, maybe go beyond your body adjusting some of these challenging work environments, and you may need to see a physical therapist or another healthcare provider for these things. And so I used to bring students, and still do, out to farm worker camps, generally late in the evening after they were done. And so we would do some direct screening care. We tried to get a real good sense of what type of aches and pains they were having, why they were having, what sort of work was associated with it, so that we then could better tailor our recommendations and our education strategies. And then we found out that, wow, this is going to be a really challenging task to provide education and or direct care for this group, these farm workers who are spread really way out throughout the mountainous areas. And so I guess I'll come back to that here in just a second. And so some of the other issues, and I think you all are well aware of, is some of the limited access to health education. I just mentioned the high incidence of musculoskeletal health conditions, and really being in rural area, and due to a number of other barriers, limited access to healthcare and to health education. And if it weren't for Vecino's Farm Worker Health Program, many of these farm workers would get little to no healthcare and or health education at all, due to really living and working in highly remote areas, also due to some of the low health literacy and general literacy, limited English proficiency, and limited financial resources. And again, this is stuff that greatly informed what I'm going to share with you guys here in just a little bit. And so before drilling down and sharing some of the stuff that we've created that I really would love to share with you all, and have you all get your thoughts on them, and hopefully share some of these resources with the farm workers that you may serve, I'm going to step back into a big zoomed out area, and just briefly talk about larger issues maybe associated with suboptimal healthcare and suboptimal healthcare value. And in some of the realms of healthcare, we define value as health outcomes per dollar spent. And I think there's evidence suggesting that we spend a lot of money on healthcare and our outcomes aren't necessarily great. So therefore, value may not be optimal. I don't want to fully lose you here with a couple of these sort of messier slides, but maybe just to focus on the 5 green or blue. I'm colorblind, so I have some challenges with those things, but just contributing factors to low value healthcare in the United States, and one being kind of a downstream approach. We're very good at addressing health conditions once they're present, but not always great about strategies to help prevent and avoid some of the more severe costs downstream. Generally, a high cost of healthcare, and sometimes inefficient and or ineffective health education models. A lot of that kind of comes in the actual healthcare settings that often are rushed and stressed. And as a result of that, doesn't always empower patients or empower clients to take greater ownership of their health. And then finally, the other thing I mentioned is kind of limited access to really good healthcare and health education for certain populations. And so that's the big broad view of sort of some of the contributing factors to what we might refer to as just low value healthcare generally in the United States. And this is just a summary of those low value healthcare contributing factors: downstream, high costs, inefficient health education, limited access to healthcare and health education, and disempowered patients. And these are really issues of equity and justice, in that the greatest health disparities are really being found in minority racial groups. And obviously this is for all of you all well aware of these health disparities that can be associated with race, but also associated with socioeconomic levels, lower in particular, and in more rural areas. And these three factors in isolation have been shown to demonstrate health disparities. And then when you combine these, we have a sense that those disparities might even increase more so. And I think we can make some level of an intellectual leap that a link between better education and improved health, that there is some link there, that by improving access to quality health education may help address some of these disparities in some of the most vulnerable populations, such as migrant and seasonal farm workers. And so a typical model of health education for farm workers related to musculoskeletal health in particular is that there is a number of years ago by the Migrant Clinicians Network developed a really awesome resource, Cuidate, in Bolivia, where I learned Spanish, the accent, sometimes the latter on command, but Cuidate. Limited opportunities for community health worker training, specifically in the area of musculoskeletal health. There's fantastic training in all kinds of other different areas, and this conference is a great, speaks to that. But the area specifically in musculoskeletal health isn't extensive, although there is the resource that's really utilized well by vecinos I know. And this is a paper-based resource, but there are some costs associated with printing and challenges to disseminate it in when farm workers live in more rural areas. And in some data that we collected in going out to these farms a number of years ago, we found that that 71% of farm workers reported no safety training. Only 29% reported that they had received some level of safety training. Now, we didn't really get a great sense of how much of that was related to machine operating or musculoskeletal health, but it did speak to that they didn't seem to be getting a ton of specific safety training, at least in the, I think we surveyed close to 100 farm workers. And I wanted to kind of go back to this, what's called the Ishikawa diagram, contributing factors to musculoskeletal health issues in migrant seasonal agricultural workers. And again, focusing on those blue or green areas of limited access to healthcare, limited availability of evidence-informed health education, And sometimes inefficient and or ineffective health education models fit in that category. But there are a couple other unique environments here in that migrant seasonal agricultural workers tend to have lower health literacy levels and lower general literacy levels, and they work in risky environments. And this could certainly lose you. The big thing I want you just to take a look at are these big green things on the left, and that the ultimate aims of some stuff that we're going to get into here is how do we improve really not just farm worker musculoskeletal health, but overall health, and some of the ways to do that in this second green thing to improve just all that are involved, including farm workers, their knowledge, skills, and confidence related to musculoskeletal health. And some of the driving factors here, drilling in a little bit deeper, are that we are hoping to focus on with some stuff that I'm going to share with you is ways to try and increase access to prevention and self-care education in the realm of musculoskeletal health. And those 4 green boxes on the right, ways of doing that are making sure that there's availability of these resources, that these resources are affordable to disseminate, and that populations are aware, both community health workers and farm workers are aware of these resources, and there's good easy ways to utilize these existing resources. And so the theory of trying to improve this health education model goes that hybridizing the health education component of healthcare, and this is really speaking more globally, not just in farm worker health population. I'll bring this statement to that level here in just a second, but that hybridizing the health education component of healthcare by using some face-to-face education, but also some synchronous, which is live and asynchronous, which is not necessarily live, pre-recorded or viewed at any time. Video-based education via technology may help improve some health outcomes by increasing access to quality health education, by enhancing learning outcomes, and by proving to be valuable resources with respect to cost and outcomes per dollar spent. And kind of taking this a step further into the local population of agricultural workers or farm workers, this theory of improvement holds that hybridizing the musculoskeletal health edu component for migrant seasonal agricultural workers, but also for those that serve agricultural workers such as community health workers, farm owners, and crew leaders, will also increase access to this health education, will help enhance learning outcomes, and will also demonstrate value as defined by health outcomes per dollar spent. And just briefly, kind of our traditional model of healthcare, we tend to prioritize that red area of tier 3, which is this highly individualized and highly personalized education model that tends to come in direct contact one-on-one with healthcare providers. And sometimes that is definitely necessary and maybe really indicated in certain situations. But it's pretty expensive and not always very efficient, and we can't always reach the most individuals. And if we kind of go down to the tier 1 in our current healthcare model, that a more effective and potentially more cost-effective education that's more generalizable kind of occurs last, with healthcare providers maybe providing educational pamphlets or providing some other resources. But the order in which this education tends to occur is that the high expensive, high cost, highly individualized stuff happens first. And so I just wonder if flipping that model and maybe prioritizing the foundational health education, in the sense of education that pretty much everybody needs, 80% or more of the population needs, in order to kind of take their health to the next level, is the first step. This is the first line of defense. And then, as necessary, we progress towards more individualized and personalized healthcare that tends to have greater healthcare costs. And I know, again, these are sort of the 30,000-foot theoretical view, and we're going to drill into the more practical stuff here in just a second. And so, when we talk about what sort of evidence exists for utilizing some of these e-learning resources, and I'm going to define e-learning as kind of some learning that occurs online, sometimes asynchronous, is that there's really good evidence for e-learning in traditional educational environments, and that in the healthcare realm, there is growing evidence, but it's not fantastic. And there is some good evidence developing for historically underserved and minority populations as well. But when we start to get into asking questions of more sophisticated ways of educating educational delivery models, like the use of a learning management system, which I'm going to share with you, there's not a whole bunch of studies on that. And so the big aim really of this project, as I sort of mentioned, is to find some ways to improve access related to educational materials related to musculoskeletal injury risk reduction in agricultural workers via using some e-learning strategies, with the hopes that it helps improve learning and ultimately reduce musculoskeletal health issues. And so our plan to try and address these issues, and I mentioned that we started off essentially going to farm worker camps, and then we attempted to do some small-scale in-person training sessions with community health workers. And as you all can appreciate, the attendees of conferences like this tend to be really, really good and high because some of the in-person visits are they're expensive and sometimes more challenging. And so utilizing a learning management system or doing some more online learning can be an effective way to deliver education. And so we want to really test that model out. Specifically tailoring the education for two audiences, one for community health workers and really other healthcare providers and anybody associated with agricultural agricultural worker health, and then specifically for the farm workers themselves. And then to collect some data and find out, is anybody any better off essentially as a result of these educational models. And so as we started to create some of these education, we wanted to make sure that they were engaging and that they were informed by evidence. And, engaging in the sense of, there's some evidence that suggests that popular education and humor and storytelling and culturally relevant education is more effective. And so we wanted to make sure that we were creating content and education that fit those categories. And also using evidence in the literature about best practices in teaching and learning, and gathering information from the key stakeholders, including farm workers themselves and community health workers as well. And so our partnerships with Vecinos and the North Carolina Farm Worker Health Program were really crucial in these areas of developing some of this content. And we chose video-based, really, essentially, because of, at least in part, the engaging component of it. And we felt that we could help tie in some popular education and peer-to-peer learning opportunities via videos. And we felt like we could add some humor into these as well. And these photos are essentially some of the community health workers with Vecinos and some of our IT folks that helped film. And then we partnered with a local farm, Darnell Farms in Bryson City, and they were fantastic. And then a number of the farm workers associated with the farm helped as well. And so I talked just a little bit about e-learning. I'm going to skip through this here. I think you all have a sense of what e-learning is. Essentially that we created these two different courses or learning series, specifically one in English for community health workers. And prior to putting these in a learning management system, we piloted these with groups of, with about 30 community health workers associated with the North Carolina Farmworker Health Program, and really got some positive feedback with regard to, it appeared that some learning was happening and that there was positive perceptions of the delivery format. And then in the educational that we created for farm workers, it was in Spanish. And we tested this out, actually showing it at one of the farm worker camps via video, and again, collected some data and got some very positive responses as well. We felt this was important to not only obviously involve farm workers and involve community health workers and other agricultural agencies in creating these content, but also kind of testing it out and tweaking it according to their preferences and important feedback. I'm gonna kind of move through here because we're gonna hopefully break out into some breakout rooms and get some of your thoughts. Before we do that, I want to direct you to this, and it looks like there's a URL posted in the chat room. That's essentially where you can access some of the content of the course for community health workers and also the separate course for farm workers. And I've got that internet address here as well. And the series in the Spanish for farm workers is called actually Cultivando Buena Salud, or Su Trabajo, Cuerpo y Salud. And we kind of focused on some of the physical risk factors for musculoskeletal health and how to really optimize movement and work task performance, and then some additional personal preventive measures. And as I mentioned, we really tried to work to make these culturally and linguistically appropriate with native Spanish speakers, and some opportunities to encourage peer-to-peer learning. And make them as engaging as possible. So let's see if I can show this. That is not popping up, is it? Let me share this. We've got this video on YouTube, so I'll just show it.
Si la comparto. Hola, ¿cómo están?
Muy bien, muy gracias.
Qué bueno, ¿cómo va el trabajo?
Bien, bien, gracias.
Traigo un poco de información para ustedes hoy. ¿Está bien si la comparto?
Claro. Sí, claro.
Bueno. Trabajando en el calor, haciendo trabajo muy fuerte todo el día, todos los días, puede ser muy duro para sus cuerpos, pero les doy una información que les traje hoy. Y si pueden sacar el folleto, es importante saber cómo trabajar inteligentemente, moviéndose de maneras para prevenir heridas. Hay un link debajo al final de la página que pueden ver, y esto los va a conectar a un video que les habla sobre cómo mantenerse saludables, fuertes y productivos, también para que puedan seguir haciendo este trabajo por muchos años. Pero si quieren sacar el celular, y vayan y pongan el link en su celular para que puedan ver el video, porque ya ven, como dicen, más vale prevenir que lamentar, ¿o no?
Eso sí es cierto. No, pues de verdad, muchas gracias, Carla. De verdad agradecemos tu ayuda.
Oiga, David, ¿y usted qué piensa?
Oh, sí, está bien. Ahorita lo miro.
Mira este video.
De campo. Sin embargo,
So that is really just a very short clip. Let me come back to so that is just a very short clip of it's a 10-minute video for farm workers. And so when you can access this farm worker video in isolation in and of itself at that address in the area of additional resources or recursos adicionales. But you can also have farm workers kind of do answer a few pre-test questions, see the video, and then answer some post-test questions. It does require that they have an email, that they enter an email address, which is one factor there. And so there's some really nice education on some lifting, and after lots of repetitive forward bending, some movements and strategies to help reduce pressure. These are obviously in the tomato farm area, and that's farm worker Manny, who's been working for about 17 years as a farm worker. And in our video series for health workers, community health workers, we interviewed him and really kind of got his story about how he got into farm working and some of the tips that he shared with us as well. And so the series that we did for community health workers, we called Physical Health Promotion in Agriculture, and you can access this learning series at that same URL address, farmworker.expertlearning.net. This takes about 30 to 45 minutes to complete. There's some really good pre-course questions, and then some post-course questions, and then some general feedback for this as well. And so those are the kind of the main topics, that there's an introduction, and then 5 videos total. The length of each video is about 5 to 7 minutes, which is kind of in the sweet spot of what they say is best for keeping attention with e-learning. And you'll notice in that webpage, it's actually a learning management system. It's Moodle, which is an open source learning management system where you can deliver seamlessly these courses and track participant usage and really track learning analytics as well. And so it kind of is a little more sophisticated way of just going to YouTube and watching a video. And this is essentially the page itself, and again, just a plug for the website itself. And actually, I'll show. Let me just show one brief section of one of these videos here, so you can get a sense of what it looks like. Not that one. I apologize, it took me. These things are kind of staying hidden on my dual screen here, so maybe when we go into breakout room, I can have you all see, but it's again, really awesome video footage. Or what I can probably do is just jump in on the, apologies, but really easy to access is the video series for community health workers themselves. Are very high quality, all done in agricultural fields, directly with farm workers, and again, using some of the same strategies of evidence-based teaching and learning strategies. So, How will we know if any of this is actually an improvement? How will we know if any of this helps address some of the original issues related to access and learning and prevention? And using learning management system, we have some ability to track learning outcomes. Did anybody learn anything? Is there any changes in confidence and self-efficacy? We can get a sense of how many people received some of the education and how many people completed the educational courses themselves, and then participant perceptions of learning. You know, how did they perceive the content, the relevance of it, and the mode of delivery. And in the learning management system, these are all good ways to kind of track whether or not this delivery method is effective. And what we really, would need now is to get some use and to get some feedback, really. And what's the optimal? Are there ways to kind of use a couple in-person sessions where farm workers get the personalized care, but also generalized care as well? The reality is that many of these farm workers that live in very rural areas, they may not get any education at all, and that's not. May not get any healthcare at all, and that's not okay. But if we can at least take a first step in trying to address some of that foundational education level, I think it's a step in the right direction. And so we're going to break up into some breakout rooms, and I'm going to, in these breakout rooms, I think I'm going to cut and paste here and make sure you guys have these questions available, because I want you to, in relatively small groups, just kind of discuss how we might be able to, what are some of the benefits of this delivery model? What are some of the challenges, and any other really thoughts you have? So I have put, let's see, actually, I need to make sure I send this to everybody. Those are questions. They're a little messy in the chat box, and I think once we get into the breakout rooms, we'll need to share those again. And so our IT person, Zach, will help us out with that. So we're going to break into breakout rooms, and I want to get your thoughts on these questions, and then we'll come back together with about 10 minutes left. So everybody that's back with us, I wonder if there's one or two things that you might be able to post in the chat about some of the potential benefits, challenges, or just other thoughts that you'd be willing to share with the larger group, and whether or not there were any themes that occurred.
John, would you mind repeating that, just because I think we got a couple more people that just joined back into the large group?
Yeah, thanks everybody for joining us. Again, sometimes breakout rooms are good, and we've got a group here where we probably can just have some discussion amongst us, but was hoping that you could either just unmute yourself and ask a question, and I'll say probably "and" would be helpful too, so that I can actually get some of your written responses too. But one or two of the themes that maybe were discussed or that you thought about related to one or more of those questions. What are some of the potential benefits of the delivery method? What are some of the challenges? And just any other thoughts that you'd be willing to share.
And actually, before anyone starts to provide some feedback on their thoughts, I'm going to put the link for the evaluation survey in the chat. And we ask that you please complete that either now while you're listening or later. And this evaluation survey is very, very important to us as so that we can continue offering you great educational sessions and content. And I'll put that link in the chat again at, towards the end of the session, in about 8 minutes. And other than that, now please feel free to come off mute or put your thoughts in the chat. Oh, actually, we have something from Amanda. She said,
thank you, Amanda.
Go ahead, John.
Yeah, just that says it's difficult to find really quality information on musculoskeletal pain. If you do, it's in English and drawings are difficult. And that's really, part of the idea with trying to distill really some solid evidence-based education in the realm of musculoskeletal health into videos that even if you can't read, that you can understand some of these things. We tried to really tailor the health literacy level as well. So that's a really good point. I think Danny in our separate chat just kind of noted that people with limited transportation that may not be able to drive to get health education from a healthcare provider, it's a way of sharing as well. There are obviously some limitations with technology in that while cell phones seem to be fairly ubiquitous and smartphones, not all farm workers have the data and or the bandwidth or signals to download some things. But what else could you share?
Perhaps the cultural competency that we have within our clinics. Some of the migrant workers that I have worked with, their literacy is completely different than some of the people that they speak Spanish, but perhaps their Spanish is more of a textbook than, I have had a couple interpreters that a lady came here and she's like, me duele el lomo. And they had no idea, the interpreters had no idea what a lomo is, and
it's the part of the back of a cow that's delicious to eat, right?
That is correct. But, not all our population are educated like that. So perhaps more understanding of the cultural literacy that some of the people are still lacking.
Yeah, I mean, that's maybe some of the challenges with some of the generalizable stuff is that you can't customize and tailor towards everybody, especially when there's some dialect differences. I've just appreciated there's like 6 words for shoulder blade, paleta, escapula, omoplato. So Whitney noted that asynchronous online stuff helps, and we developed this stuff pre-COVID, but it seems particularly relevant in the COVID area. And so the face-to-face really adds that context and personalized part. And so, while I labeled the title of this hybridizing it, because we don't really think that, unpersonalized, pre-recorded online education is the end-all, be-all. That's not what the literature says. It says that you do need to contextualize it, you do need to tailor it, and it does need to be personalized. And so coupling it with some face-to-face, I suspect maybe ultimately optimal, more optimal. So that was really good point, Whitney.
If anyone would like to speak, if you just raise your hand if you click the reactions button and raise your hand, we can unmute you if you would rather speak instead of putting something in the chat.
Yeah, so in terms of technology, Alexis noted more resource navigation agencies that provide free or low-cost devices and internet services. Yeah, that's the bare minimum here is making sure that people have devices and have internet services. That isn't universal just yet. Let me briefly just, while these questions are coming in, share. Can you all see the web page now?
Yes.
Somebody shake their head, Krista. Okay.
Yeah.
So this is the main web page. These are where those additional resources The video that I showed you that's 10 minutes long, this is, you can view it directly from the site, or this link down here is a YouTube link.
John, when you're finished showing us this, we have someone who would like to speak as well, Cruz.
Great.
But whenever you're finished.
Yep, I will pop on out. I just want to make sure that you all got to see that. And I need to stop sharing. Are we back to not sharing?
Yes. Yep.
Okay, good. Okay. Okay, sure, go ahead. Was that a hand raised that we're going to unmute?
Yeah, I believe so.
Okay.
I'm not sure of the person's name, but their name is A. Cruz on their Zoom. Hi.
Yes. Hi.
We can hear you.
I was just going over the survey of this presentation, and it's asking about a lady, Claudia Ramirez.
Oh, are you talking about the link that I put in the chat?
Yes, the link that you put there. But see, I mean, I don't understand. I haven't heard her speak. Why am I being asked to evaluate her presentation?
Yeah, you shouldn't. Let me put the link in again and make sure that it's the right one. Sorry about that. Thank you for bringing that to my attention.
Okay, thank you.
And John, I believe we have a couple other.
Yeah, and Heather mentioned just some of the internet infrastructure in rural areas. I mean, as I mentioned, rural Western North Carolina internet is definitely an issue, and we found that still most of farm workers, do have some bandwidth, and if they don't, at least the farm worker health agencies like Vecinos can come out and show these videos to larger masses, which we've done too. Katrina mentioned if the resource for community health workers are in Spanish, and no, when we developed these directly for the North Carolina Farm Worker Health Program, they preferred them in English. So we did them exclusively in English. It's not difficult to get those to do some voice overlays in Spanish, and we certainly could, but since they asked us to do them in English, we did them in English. Oh, and how much the resources cost? Really good question. They're absolutely 100% free, and they will be 100% free. We chose to put them up on Moodle because there's really no upkeep cost once they're there. Again, to sort of take the courses, you do have to put in your name and a valid email address to verify it. Are the only issues there, but 100% free. That's part of the deal about value. Hopefully, outcomes per low cost or no cost. Well, I think we are just about out of time. Again, really appreciated the opportunity to share some of these resources with you. Really appreciate some of your questions and discussions, and would even more greatly appreciate those of you that have the time to take some of these courses and provide some feedback directly after you've taken these, so that we can continue to improve them and iterate them and help better tailor them to meet the farm workers. So again, so grateful to be part of this conference. Thank you all for attending.
And thank you, John, for giving us such a great presentation with such critical and useful information. And I have put in the chat the survey link, and it should be the correct one. I double checked and I went through it myself, and it does have John's name on it. And I just want to reiterate my thank you to John, and also my thank you to Marthala, our wonderful interpreter for today. So much thanks to you. And also thanks to all the attendees. Thank you for joining. And we hope to see you at some more sessions today. Thank you.